So for all of those that you're watching this live, wish me luck here.
Representing almost 200 million people in this country live with at least one chronic disease: obesity, diabetes, heart disease, hypertension. Our children, the situation is equally alarming. Approximately 20% of our youth are obese. 1 in 3 adolescents age 12 to 17 have prediabetes, 1 in 3. And when it comes to our mental health, at least 1 in 5 American adults, 60 million people experience some form of mental illness each year. Those are epidemic numbers.
Unfortunately, the vast majority of American adults now have metabolic dysfunction. By some studies, 93% of Americans, adults, have at least one biomarker of metabolic dysfunction, meaning there's this fundamental whole body cellular energy production problem that we know is deeply related to our diet and our lifestyles, that then underlies diseases emerging all over the body, things like dementia, cancer, chronic liver disease, diabetes, obesity, heart failure, heart disease, stroke, et cetera. Nearly 150 million Americans are on federal healthcare programs, and we spend $50 billion per year on research. Yet outcomes are worsening and disparities are widening. Our nation is angry, exhausted, and hurting from preventable diseases. Rates of high blood pressure, many cancers, autoimmune conditions, type 2 diabetes, mental health disorders, dementia, neurodevelopmental challenges, and youth suicide have all increased in the past 2 decades. We are now the most chronically ill, high-income nation in the world. We live shorter, sicker lives than peer high-income nations. Today's children are projected to live shorter, sicker lives than their parents. Our bodies are telling us this current path is totally unsustainable. There is another way, a path that unites rigorous science with reverence for our miraculous bodies and planet, and brings Americans and our medical institutions together around actual healing and prevention. Mental and physical health are unraveling from shared root causes that we can fix. Preventable heart disease, diabetes, representing cellular energy collapse, is draining our human potential. Dementia, depression, and neurodevelopmental decline reflects a society losing its mind. We must confront this epidemic through a vision grounded in science, dignity, shared humanity, and a respect for freedom, not politicization and division. Public health leaders must address the evidence-based, modifiable drivers of chronic diseases, which include ultra-processed foods, industrial chemical exposure, lack of physical activity, chronic stress and loneliness, and over-medicalization. I've been asked to help our nation get healthy and answer the call of millions, especially mothers, who are begging for transparency and support. As a physician, I've always been inspired that the root of the word healing means to return to wholeness. Nothing is more urgent than restoring wholeness for Americans, physically, mentally, and societally. Specific efforts are already underway to fund and promote more whole, healthy food for Americans, starting with the Dietary Guidelines for America, which came out about a month ago. We need to upgrade the paradigm of the American healthcare system to educate and treat in that way. It is by far the most efficient way to treat, of course, because if we're addressing shared root causes, we're going to be able to stop the whack-a-mole medicine that's not working for us and that is so costly. Reforming medical education to focus on root causes. And one of the key root cause modifiable factors of chronic disease is nutrition. Mature, candid, grand conversation about how our medical education and fixing perverse incentives can pull us back from the brink. This path is also economically sound, with the potential to save trillions of dollars annually.
The world.
Okay, I'm pausing there for a minute.
Okay.
That's part one. That's the whole case for System C right there. It's as if she's like the spokesperson of, we need to fix this, right?
Well, if you were listening to it and not watching it and you had no idea who the person was, would anybody disagree with what she just said?
Correct. Like, how could anybody disagree with that, with what she just said, right?
Well, the disagreement would be, well, people won't execute that, so we still need to have a belts and suspenders approach, so we should spend $4 trillion on healthcare. It's a very big belts and suspenders. It's like belts, suspenders, complex. Yes.
So
your question.
Well, so that's
really looking forward to what Markey has to say next. But
well, right. Okay, so that was the first part, and so that's
I have
the
a
whole.
history with Markey that frustrates me. But anyway.
Okay, well, he has one. I let him say one line in what I see. This is the beauty of creating your own highlight reel. It's sort of put in here.
I mean, yeah. I do have to give you my history. So I was working on ways to really deal with the energy problem.
Okay.
Dealing with upgrading public buildings with more energy efficient things, and we come up with an approach, which we sold to Johnson Controls, and it's one of the startups that did it. It's where I was the president, and we early IoT, and we would go into states and reduce their energy spend of the state government buildings by like 20%. And so we were talking to Markey about this and said, you're big on the green stuff, and if you change the law from this way to that way, it would help accelerate the adoption of these types of technologies, and it would get us 20%, like we have proven. We'd proven this. We went into a state and reduced their energy spend in 1 year by 20%. It's proven. And he said, well, that change would reduce the number of laborers that the unions had because it would prioritize tech over labor. Like, yeah, but it would reduce energy spend by 20%. It's like, oh, well, but the labor unions, so he was like yelling at the top of his lungs how everybody wasn't paying attention to environment, but it was, when you really came down to it, he was more worried about the labor unions, which is a legitimate concern. I'm not saying it's not a legitimate concern, but don't say that you care about this thing really, really, really a lot, and then say, I won't move forward on it because I'm afraid of the labor unions. Say, well, we have to figure out a way to work this through so that we can work in cooperation with the labor unions. He didn't say that. He just basically said, I'm more worried about the labor unions than I am about the environment. So it's like, okay, well, say that publicly. Say, we want to save the environment, or we want to save healthcare, but only after we make sure that don't disrupt the current system B architecture. We got to make sure we protect system B before we protect the human people.
But here's what's interesting when you listen to this next piece. So the first piece was all about root cause and redesigning healthcare. And what I find fascinating about it is Casey's the only one talking about it. So there's like two other sections to this.
Or, I mean, other people are talking about it, but Casey's...
Well, but in this hearing...
Let's take it one more step. Sorry. Casey, they're like, oh, you didn't finish your residency. You're an idiot. Why did she... I know Casey, and I know many of these people who are controversial in various ways, and I'm not taking a side in any particular way, but I do know why she quit. And she quit because she's like, to finish my residency, I have to buy into a program whose job is to make sure that we charge $100,000 every time we have to fiddle with somebody's heart.
Exactly.
And she's like, I'm not going to do it. So that's like a conscientious objector kind of movement. I mean, I interpret it, she might be wrong, but when I hear her tell that story, I hear conscientious objector. Now she didn't move to Canada, but like, that's what I hear. And I don't hear I'm a whack job that wants to jump off the cliff and ignore science.
None of what she just said
after that, I don't know. But
like, for example, I'm not even going to get into the vaccine. I'm just going to say this. I didn't want to bring the vaccine debate into this, but to your point, how she talked to everyone's pointing a finger at her on vaccines, which I understand. Talking about vaccines in any shape or form other than go get them is a problem for public health. Like, I totally get that. But her answer to the inquiry was not, you shouldn't get vaccines. which is what the media really is trying to make it seem she said. Instead, she said, everybody should have the right to talk to their provider about their decision for themselves. And, you know, we
Did you
tell
see
everybody
what
that.
what people said on X as a result of that?
What's that?
There were a bunch of doctors that came out on
Right.
social media afterwards, and they're like, well, the patient doesn't understand well enough for them not to just do what we tell them to do.
Correct. I mean, I get it, but in essence, every time you walk into a doctor's office, you're supposed to be able to ask questions. Like my point is like, that's just a patient-doctor relationship, which is you're supposed to get your vaccine. Okay. Should I?
Well, if the patient isn't supposed to be able to ask questions, then yeah, I guess a 7-minute visit with a doctor is probably okay.
Yeah. Okay. So
okay,
that's
let's
the
listen
first part. So now this next part is where it's interesting. This kind of gets back to, I do feel like there's some protectionism, and this happened in my own house. My husband and I told you this yesterday, he brought up glyphosate and this 180, his perception that there's a 180 of RFK Jr. on glyphosate. And, my pushback, again, I don't support or not support anyone in this. I'm focused on the message here, and I'm focused on what we're trying to accomplish and the tailwinds that are being created currently for a lot of the work that you and I are doing collectively. So in the spirit of that, my point was, I'm still hearing RFK Jr. say that he thinks it causes cancer. And I'm not hearing him say anything other than that. It's this whole issue of how do you handle how prevalent the use is of glyphosate, for example. And you've made some other points about that. So let me just play this first. This is the glyphosate piece. And
the great Edward
so for
Murphy.
anybody that's jumping on now, I put together, just to put into context, I put together a highlight reel from Casey Means, who is up for Surgeon General. She's doing her confirmation hearings. It got delayed because she had a baby. Apparently, she went into labor the day of the hearing in October, which is why it got pushed off. And so this is the highlight reel I produced, and this is the next piece of it.
Health Organization has explicitly stated that glyphosate damages our DNA and probably causes cancer.
There's grave issues with these chemicals. I think that we are in a very complicated moment for agriculture and food. We cannot overturn the entire agriculture system overnight. That would hurt farmers. It would hurt food prices. This is a national security. It's a complex issue. And obviously changing anything overnight would be devastating to the American farmer and the American consumer. With that said, this administration is committed to understanding what's in our food and how it's affecting our bodies and how cumulative exposures to various chemicals in our environment is affecting us. And that is a core, profound, long-term, deep passion of mine as someone who thinks about how our environments and the system that we live in is affecting our health in the midst of this monumental chronic disease epidemic. And certainly pesticides, herbicides, insecticides is something we need to look into as part of that cumulative exposure. At the end of the day, we do need to understand how these chemicals are affecting our bodies and work towards creating the safest. For investment in research and studying of soil health, water quality, nutrient density of food, and how that's affecting our health, we are going to need to move towards a more sustainable way of growing our food that decreases our reliance on toxic chemicals that ever are hurting human health. Regenerative agriculture transitions, precision agriculture, and the private sector collaboration. We are going to make sure American consumers are protected and that we are entering an era where we are going to prioritize helping farmers move to more sustainable farming practices. I think those are all good things. I think it's extremely important both for our planet and our health. And I'm going to be a champion on that issue.
The Maha movement is not happy with the Trump executive order. Okay, that's the reality.
My focus would be on making sure that we are protecting American consumers and their health and making sure that we are having transparent, honest conversations.
You say you want.
I'm saying this is the last part. So I paused. So
Is there anything more back and forth on that? I didn't get a chance to look through this. Was there more? Because I've been, for everybody else's benefit, I've been like in the middle of this conversation, especially in the June-July timeframe, and there are other colleagues we work closely with that have been on both sides of the issue and very deep, and we know. Frankly, I think Casey's response there is exactly the response I gave to RFK, which is we got to fix, if you could get rid of Roundup and then we're going to be in paraquat, which is a lot worse. Or you could fix soil health, fix nutritional density, and get a win across the board. If we focus our resources there rather than litigation, then we're going to get to the next step. If you litigate the whole thing, we'll just back solve the paraquat and we won't solve the problem, and then everyone will be pissed at each other. And the general response that we had as a result of that, and it was a combination of things. It was the Heritage event. It was 2 meetings on the Hill with Rollins and RFK. It was the work that Kip Tom's doing in terms of explaining industry's viewpoint. It was a lot of work even with Callie to sort of help Callie understand the context of it all, which sort of closed the gap between viewpoints. And then we know some senators involved. It was about I would say the thing that the win that we want, the System C win, is make it so you don't need Roundup.
Exactly.
And that's, and
I mean, that's why I went and visited Clint with Greenfield Robotics. That's why I went to his farm to see his robots, right?
The System C answer is make it, and we know how to do that. And you take John Kemp, you take other people, you take some of the startups that we've been involved with. We've been on this for about 10 years. It's not the easiest thing to change. Roundup was invented was first discovered in 1962, became commercially available in 1972. Helped revolutionize a lot of their production aspects. Once it was fully implemented and understood, it actually turned Brazil into a high volume producer and actually has harmed us economically because of that. But it's been on a long journey, and so I think the focus of getting shift away from it is the right answer. The System C answer is fix soil health, fix human nutrition, fix nutrient density, fix food nutritional quality, and you won't. If you have better soil health, weeds are a signal of poor soil health. That's like a really fundamental principle that not many people understand. Weeds show up because the natural system in the soil is disrupted. And if you fix that, your weed pressure will be dramatically less. End rant, sorry. That was really good.
No, it's okay. But I mean,
what happened next?
So now we go back to System B. So I guess the biggest observation for me when diving into this was it's literally like the tale of two systems in this conversation. And you have Casey, who's like, look, we have to redesign the system, both at the healthcare, soil, food, right? Like, she's not calling it System C, but she's defining that this needs to be approached differently, that we have to do things in a different manner. And the hearing is going on as if that's not an issue, right? And so I just found it really striking to hear like the points, which is, sort of like glyphosate causes cancer. We need to ban glyphosate, or, ultra processed food is horrible, or this and that. Healthcare is costing so much money, right? And so now I'm going to play this part.
I do want you to do one thing as long as you're right here. I know you got that set up, but I'm sorry one thing. Can you just move without playing and move the slider back just to the end of Markey when there was a pan of the whole panel? Right there. Look at that. This is a hearing about her. Every one of those seats this is a committee hearing, and I'm not sure which committee it is, maybe a joint committee. There should be 15, 20 senators sitting there. They're not there. No. So for people that don't understand this process, the process is a bunch of staffers prepare questions for the member. The staffers need to prepare those questions. They go basically to lobbyists, prepare those questions. They hand them to the staffers and say, and depending on which the relationships there are, the staffers basically align the questions. They do it one of two ways. They either get the questions from the person who's going to be the presenter, if they're on the same team. If they're not on the same team, they go to the lobbyists who can come up with the most poignant pressure point to get an event. So, and they show up like this. No one else is there, or very few. I mean, look at it. In that picture, that's a little more than half the room, because you got the center member there.
Yep, I'm going back over here. Here's another one.
So nobody else is there. So they left. I mean, they come and they go, and
Yep.
they're not there to listen.
Nope.
It's all theater on both
Yep.
sides.
I know.
Both sides of the equation. So Casey's probably tuned up to get sound bites and their media reviews by people who are expert with this on the back end. But anyway, so that's the fun behind the scenes.
All right, here's the last clip. So now we go back to System B.
You say you want to address chronic disease, but 1/3 of low-income adults have 2 or more chronic conditions. They need an affordable solution. Groceries are too expensive. Healthcare is too expensive. Health insurance premiums have skyrocketed. People cannot afford their prescription drugs. So you've said that our healthcare system is broken.
In America today, we spend over $5 trillion a year on healthcare. Believe it or not, that is more than $15,000 for every man, woman, and child in our nation. More than 500,000 Americans go bankrupt due to medically related debt, and 68,000 Americans die every year because they cannot afford to see a doctor. If anybody in the world thinks that that is a rational healthcare system, you're living on another planet.
Did he say 60 million?
As bad as our overall.
Well, did he say 60 million or 6 million?
He said
Die.
68 here.
And 68,000 Americans
No, 68,000.
Keep going.
die every year because they cannot afford to see a doctor. If anybody in the world thinks that that is a rational healthcare system, you're living on another planet. Further, as bad as our overall healthcare system is, our primary healthcare system is even worse. Today, tens of millions of people live in a community where they cannot find a doctor, a dentist, or a psychologist, even when they have decent insurance, while others wait months to get seen.
Oh, Roger spoke. Or is that different? Okay.
That's what I pulled together. So, okay. Now, the other thing I want to cover, which I kind of feel like I want to do it right now, because we didn't do this last week and it's very fitting to do it at this moment, is, and then we'll jump into this discussion, okay? Now we've got the 60 minutes thing.
I didn't see 60 minutes. You're getting a lot of time to watch media. How do you do that?
I'm not. Do you want to know what I really did here? I'm very proud of myself.
What'd you do?
This whole thing took me about an hour and a half, and it was only because I had a learning curve. So if I didn't have a learning curve, I probably could have busted this out a lot quicker. So now we're going to talk AI. We're going to talk tools. So I downloaded the C-SPAN. I started with the voice only clip sound, and then I switched over to video because I wanted to be able to show a highlight reel. So I downloaded off of C-SPAN the video, and then I asked Claude for tools that would automate a highlight reel for me using what I wanted to highlight. It gave me I had this tool. I actually used Riverside, but this other tool would do it. I had to create the transcript, right? Then I pasted the transcript in Claude. Claude obviously knows about System C very well, and said, what would you pull from this 2.5 hour thing? Because to your point, I did not have 2.5 hours to sit and do this. And it gave me those highlights. Now I added to it and I moved things around, and this tool was like super easy to use. And then I created that highlight reel.
Oh, cool.
It was very cool. The other thing now with the 60 minutes, it was not as easy, although it was, in that it's been a week. So all this stuff has been sliced and diced. And so I just picked a couple of clips. But I think it's
Okay.
really good to jump into the 60 minutes episode as well. So let me tee that up. And then we can dive into talking about it.
A 67-year-old government classification for substances in our food. It's called GRAS, or generally recognized as safe. Kennedy and Kessler say it has allowed big food companies to use ingredients without a full government safety review and flood the market with ultra-processed foods that now make up 50% of our calories and 60% of our children's diets.
Over the last 40 years, the United States has been.
So just for those watching, this is Kessler, the former FDA commissioner.
He's looking old.
He has a beard. But it's
I guess he
probably,
is.
maybe it was recorded during, what is it, Manuary? What's January where you grow the beard? Or that's November.
I had no idea.
Exposed to something that our biology was never intended to handle. Energy dense, highly palatable, rapidly absorbable, ultra processed foods that have altered our metabolism and have resulted in the greatest increase in chronic disease in our history. Type 2 diabetes, prediabetes, hypertension, abnormal lipids, fatty liver, heart attacks, stroke, heart failure.
From our food.
From our food.
David Kessler was commissioner of the U.S. Food and Drug Administration during the 1990s when he helped expose how the tobacco companies manipulated nicotine levels to hook consumers.
I am here to provide you with actual instances of nicotine control and manipulation in the tobacco industry.
If you raise your right hand.
Which, by the way, my husband was very involved in that litigation in Maryland. He was on the plaintiff's side and actually did a lot of the depositions for that ruling.
He was a driving force in bringing tobacco executives before Congress and turning public attention to the industry. He's now aiming to do the same with the food industry. In terms of a public health crisis, how does this compare with tobacco?
It's as large, if not larger.
It's that significant.
The scale of this affects everybody. Understand, not everybody smoked. But look at the number of people who consume ultra-processed food. It touches all of us.
70% of Americans are either obese or overweight. And it's not because they got indolent or because we became lazy or because we suddenly developed giant appetites.
So I just have to call that part out, Carter, because the number of times that I hear within the healthcare industry, it's because people are lazy. It's because people don't care. It's because people don't want to change. Like, we have to really pay attention to the science here because it's not what people think. So I'm going to keep going. I have to make that point.
It's because we're being given food that is low in nutrition and high in calories, and it's destroying our health. I see it when I go across the country.
We met with Health and Human Services Secretary Robert F. Kennedy Jr. last month after he issued new dietary guidelines that for the first time advise against highly processed
Do you think that they had him take his shirt off? Sorry.
foods. You have said that these ultra-processed foods are poisoning us. I think many Americans would be surprised to hear that.
And we're seeing in our population people who are obscenely obese and at the same time malnourished. Who wants a sign?
Kennedy says that's largely because we don't know the health consequences of what we're eating, thanks to the grass exemption enacted by Congress in 1958 that allows food companies to independently verify the safety of their ingredients with no government oversight if they are generally recognized by experts as safe. Pending White House approval, he intends to close that back door.
That loophole was hijacked by the industry, and it was used to add thousands upon thousands of new ingredients into our food supply. In Europe, there's only 400 legal ingredients. This agency does not know how many ingredients there are in American food.
We do not know.
They do not know. The estimates are between 4,000 and 10,000. We have no idea what they are.
How do we know what is safe to eat?
There is no way for any American to know if a product is safe if it is ultra processed.
For his part, David Kessler is petitioning Kennedy to go further and outright revoke the GRAS status for dozens of processed refined carbohydrates, sweeteners, and starches such as corn syrup and maltodextrin, unless the companies can prove they are safe and not fueling obesity.
They took starch, right? Those cheap, easy calories, and they converted those into a whole panoply of ingredients that it was able to reassemble. And those products are so rapidly absorbed in our system that they cause metabolic havoc. They target the brain reward circuits to keep us coming back for more. They trigger overeating. They deprive us of any sense of fullness.
What we all call empty calories.
Those calories are not just empty, they're ending up in your liver. And that fat in your liver is going to migrate into other organs, and it's the cause of cardiometabolic disease.
Kessler, a pediatrician, filed his petition with the FDA after zeroing in on GRAS ingredients listed in plain sight on the backs of packaged foods.
Pick up any one of these products. You ever look at the ingredient label?
A lot of them are things I can't even pronounce.
Right. Is that food? Corn syrup, corn solids, maltodextrin, dextrose, xylose, high fructose corn syrup.
So, you know, Lustig regularly talks about these things don't meet the definition of food. You know, I mean, we're talking about ingredients that are put into quote unquote food, but when you look at the definition of food, it's not this. So we'll keep going.
And then these ingredients were subjected to industrial processing so that our system can't handle it.
We will act on David Kessler's petition, and the questions that he's asking are questions that FDA should have been asking a long, long time ago.
Kennedy told us he will use gold standard science to review GRAS ingredients, but his credibility on that score has been widely called into question because of his history of vaccine skepticism and his agency's revision of the childhood vaccine schedule. Are you concerned at all that your stance on vaccines might make people reluctant to support you on ultra-processed foods?
My stance on vaccines is the same. People should have good science and they should have choice.
Some doctors worry that the new immunization schedule sows confusion and will lead some Americans not to vaccinate.
Applaud that.
If you don't trust him on vaccines.
Sorry, I'm going to jump over now to pollen. And for those watching, it's not that I don't think that vaccines are an important discussion item. It's just not what the point of this discussion is. So go back over here.
Well, I think one thing I'll say is, I think, so you have three voices in this conversation that we've sort of covered, I think.
Well, we're getting ready to cover a fourth, but yes.
And even some others in terms of the senators. I think I'll throw Bernie in on this. So you've got Kessler, who I think people have always had a tremendous amount of respect for. they've been frustrated with him, but have always had a lot of respect for him. You know, pediatric, Harvard MD, Amherst, smart guy. I think he practiced for a while, did a lot while at the FDA. You have who basically is articulating the gut liver brain axis issue that Lustig has really been on top of, really is the leader of that conversation of don't think about reducing sugar, think about reducing the harm against the liver, which is what Kessler just said. So you've got Kennedy, who's a lawyer and is passionate about the problem because he understands it from the plaintiff's side.
Yep.
And he, if you think about it, he built his passion from the fact that people felt harmed and he felt affinity to it. He's not a doctor, and I might give him a moment of grace simply to say that he's articulating the problem as best he can. He's articulating the problem as best he can, and I wish maybe sometimes he'd do it better, but he basically said the same thing Kessler did. And Casey basically said the same thing. So they're all basically saying the same thing, and Bernie basically is saying the same thing from the standpoint of the system's not working. So
yeah, but it certainly would be helpful. Look, it would certainly be helpful if Bernie could say, we have to do something to prevent these costs. Because that's what I never hear him say.
Yeah, so I think then the question is, now everybody's frustrated. Now who's going to lead us out of
right? Okay, so let's wait before we do that. I just want to add Paul into this, and then we're done with our video watching extravaganza. That's the word I'm looking for.
We have a national eating disorder, and we know that because it's making us sick.
And the granddaddy,
Yeah.
Oreo. We spoke with Michael Pollan, who is a food author, and he has been warning about factory processed foods for decades now.
Heart disease, stroke, diabetes, even dementia are linked to a bad diet. 70% of Americans are either overweight or obese. So it seems pretty clear there's something wrong with the way we eat.
And all of those diseases you mentioned can be
And for the record, my mom's dementia, vascular dementia, related to what she ate, period.
Tied into our diet?
Yes, they can.
And there's a very interesting recent study that addresses this.
The most interesting, significant study brought people to a location where they had to live for a month. And for 2 weeks, people had ultra-processed food. They could have as much as they wanted, and the other group could have whole foods. And what he found is after 2 weeks, the people on the ultra-processed food, they were eating 500 more calories a day. He hypothesized that it's energy dense. Every bite, you're getting a lot more calories.
Pollan told us that many of these foods have been stripped of fiber, which makes us not feel so full and want to eat more.
There's a set of nutrients we evolved to love. Sugar is a great example. It's quick energy. So we evolved to seek it out and to love it. And as long as it was rare and special, it wasn't a problem.
So should I admit now that I'm thinking about how I want to go in my freezer and get a chocolate? Like, is this like not the time, Carter, that I should do that?
You're not obese. You're in very good shape. You're probably okay having some chocolate.
But with the ubiquity of sweeteners now, many of them derived from corn, sugar is like the cheapest commodity going. You pick up a jar of canned tomato sauce, you will find sugar in it, either high fructose corn syrup or one of the many forms in which sugar comes. And if you look for these labels, you will find it.
The Consumer Brands Association told us that the companies they represent innovate to meet consumer demand and adhere to FDA science and risk-based evaluation of ingredients before and after they are in the marketplace. In 2009, Pollan wrote a bestseller called Food Rules, an Eater's Manual. It offers tips for maintaining a healthy diet. It's been turned into an illustrated version. 1. Eat food, not too much, mostly plants.
Yeah, that's my dietary guidelines. And I wouldn't change anything. If you can't pronounce the ingredients, it's not food.
Yeah, something a third grader couldn't pronounce.
Right.
Don't eat anything you see advertised on television.
Yeah. So the
Really?
real food.
Okay. Once my broccoli
Eat
commercial
real
comes out,
food.
he's going to have to edit next year when I get my broccoli commercial, Carter. When we get our broccoli commercial, Michael Pollan's going to have to edit that. I guess even after the Super Bowl commercial, right? But sorry.
So I'm opening up. Yeah, do something here.
Doesn't have a budget. Broccoli doesn't have an ad budget.
There you go. Oh my God. Did you just hear that? Did you just hear that? I need to replay that for everyone. That is probably my favorite thing ever.
I do. Where's that big hump?
What?
Anyway, replay that part. Yeah.
I'm super excited right now. Like, so excited.
Real food doesn't have a budget. Broccoli doesn't have an ad budget, whereas PepsiCo or Frito-Lay, they have these huge ad budgets.
What do you think he reads our Substack?
Substack.
Oh, that would be the ultimate. That would be like my ultimate compliment.
Marketing. Let's say this is $15 billion of marketing means little. So they spend
that's what he's talking about.
The processed food industry on food spends $15 billion a year. The real food industry spends $400 million a year. If you take a consumer at Albertsons and they switch from in-store purchase to online purchase via the mobile app at Albertsons, they index 8%, 7% more towards whole food. So despite $15 billion of NCAP and marketing, they still, that quickly, the consumer will switch back to. And why is that? Because 350,000 years of human evolution, $4.5 billion of ecological evolution, billion years of evolution, have yielded a system inside humans that have a certain preference. And so when doctors say people won't change, when CPGs say people want to eat this, the reality that they're on fragile, they've got a sandcastle, they're on fragile soil, because it's not clear that if offered the right thing. And so then when you start thinking about this problem and you think about the investment, is if anybody steps in and triggers that switch, I mean, if it's that easy through a digital means to switch somebody 8% more to whole food, sooner or later someone's got, an entrepreneur's going to step forward and the asteroid is going to hit and the system's going to change. And we sort of see that with Yucca. All of a sudden somebody, category manager, wakes up at a CPG and they're like, why did I just lose 7% sales? Like what,
yeah,
that never happens. Why did that happen? Oh, it's because I'm showing up right at Yucca. Oh, we think Yucca's wrong. They aren't catching this. Like, well, okay. But the consumer, that quickly, the $15 billion per year investment that you're making as CPGs to lock on the goodwill of that consumer is that fragile. That when you give them that extra piece of the consumer, that extra piece of information,
yep,
they escape you. So they have zero goodwill associated with you. You have the instantaneous marketing that's working on them for the moment that's sort of keeping them in that threshold. But their valence level, they'll skip valence level in a moment if they have another orthogonal set of data that hits them and shifts them. And so that's the fragility of the system. And I think the message to entrepreneurs out there is, and I think this is a responsibility we have to do. We have to build a column of data that says on the system B column, here's the argument that people want system B. On the system C column, here's the argument that people want system C. And there's a balance there in which we've already demonstrated that the sort of stasis is 15 billion in marketing versus 400 million. And Whole Foods still wins.
Yeah.
And that when you move people to digital platforms, there may be a selection bias there, but you move people to digital platforms, they quickly move to Whole Foods. So there's a fragility it's a fairly unstable world that CPGs live in. That it really the only issue maybe that they have is this: the escapes can't go eat enough whole food because there's not enough production. And so then you start seeing
and
price
that's
come
what
up.
I pointed out when the dietary guidelines came out, right? Was like,
But even there, the production is, will adapt. And frankly, you could pay 20, 30, 40, 50% more, and it's probably will cost you less on a net present value basis than $500,000 of lifetime value cost of chronic disease.
so our buddy Andy over at Garmin Health, Carter just gave you could throw the asteroid. Garmin Health could use this, run with it in some creative way, and throw the asteroid for real food. I love my watch more, by the way, mainly because it's telling me that I'm running faster, and that's making me happy.
I'm sorry, did Andy just say that online?
No, I said that because Andy sent me a note, and so I decided to give him a shout out, and I just said they could chase it.
Yeah, I reached out to him because I was thinking of putting my bike on one of their indoor trainers.
You could ask me these questions. I've had like every indoor trainer known to man over time.
You do? Do you like the Garmin or do you like the Wahoo more?
Do
you have a digital one or do you have a?
Well, now I will tell you, I've had both. They both have their merits.
Don't throw any under the bus.
What? I'm not. No, they both have their merits. I, interestingly enough, now prefer to have a not my bike on the trainer. So, like, meaning
they have one if I had the money that's like $3,500, but we need a lot more subscribers before I can buy that.
All right, so we're gonna do a crowdsourcing for Carter's exercise bike while we're online today. All right, let me finish.
Hold on. I gotta finish a prompt here.
Okay.
I'm in co-work and I'm saying in a recent 60 Minutes RFK interview.
What are you pointing to in co-work?
He said, hold on, he said that in Europe, they only have about 400 legal grass ingredients. In the US, FDA has no idea how many different grass ingredients are in the US food system. He thinks it's somewhere between 4,000 and 10,000.
Yes.
Can you help me analyze somewhere to determine the entire list of 10,000 grass ingredients to build a detailed database that would help the FDA know what the entire range of grass ingredients
includes. Why are you doing it in co-work versus just regular?
There are in current food products. I better do Opus Extended here. Opus.
Oh, okay. Why are you doing it in co-work?
Well, I'm going to move over to CLI afterwards, but I'm just starting here.
Okay. So there's not any particular...
I don't know if I want to go into this because that's a deviation, but...
So I hear that Andy agrees with me, by the way.
On what?
My point about the bike.
Oh, he wants me to buy that $3,000 thing that they have?
You need to have a smart bike. He just sent me a link to it.
Well, if we could get 60 people.
This is what he wants you to get.
I want that too. What kind of discount? Does he say what kind of discount he could get me?
It's on sale already for $400 off.
No, but can I get like a Garmin discount?
I don't know. Maybe he'll text me and answer that question while we're live. He's like, wait, I do not want to be part of this conversation. and you brought me into it. He's just smiling
So that's
right now.
like we need like 60 new subscribers on paid, and I can get that.
Well, we have 65 people watching. So if somehow 60 of the 65 people here today are not subscribers and you can get them to sign up for their annual subscription today, then
I will do a video next week of me writing it if Andy can get one here quick enough.
this is like the best thing ever. It's just so much
Or
better.
maybe
than
Andy
these
Andy could
videos.
send me a loaner. I'll take
There
a
you go.
loaner for
He
a while.
just set up a GoFundMe page for you.
No, Wilson probably did.
No, I got it from Andy. Wilson probably has it over with Uni. He's probably like, hey, Uni, let's create a GoFundMe page for Carter. They're on live stream right now talking about getting Carter an exercise bike. I'd ship you. I'd ship you. You can't have mine. Well, I could ship. It would be too much money. I have.
But if Wahoo's got one too, we can get a competition going.
I have one already. I've got a bike already that I'll. Oh, I thought you meant you and I could have a competition together. That would be pretty fun.
That's what's going on co-work for RFK. If RFK's listening, this is a massive and genuinely important project, Carter. The grass gap is one of the biggest structural failures in U.S. food system. The FDA literally doesn't know what's in the food supply because of self-affirmed grass loophole. Let me start by mapping the landscape of where these substances live. Let me research the current state of grass, and so now I have a clear picture. It's working in the background on this.
Well, you should text. I should text Ryland because isn't Ryland with RFK today? Be like, Ryland.
He is with RFK right now, so tell him we might have a report for him a little later. So on the EU side, there are 333 authorized food additives with E numbers. The 400 figure is roughly correct. US side, nobody knows the real number. FDA substance, FDA, blah, blah, blah. There's significant overlap between these lists of substances added to food, blah, blah, blah. Strategy for building a comprehensive database. Phase 1, it's phase 2. What can I do right now? Pull the FDA data, do blah, blah, blah. This would give us the most comprehensive.
Real time, Carter, and AI.
Pull this data and stick it
where the sun don't shine
to my grass folder. I think later I will use Claude CLI to build a Python script to crawl the web and build an app for Bobby. So he has a good list. I've got a crazy thought here. Another crazy, just to go into crazy land with, who's a Michael Bass? There's a guy, I don't know if you know this, Kevin Bass. So he's a little controversial character. Kevin was kicked out of med school because in med school he said he didn't think treatment was right, and he was whatever. He had a very controversial exit in the middle of med school. So now he's sort of burnt and he's pissed off at the Illuminati in various ways. So he is now on the Epstein path.
Oh,
and he's taken the entire corpus and he has put AI on the corpus and extracted Epstein's calendar and now has a live thing online of Epstein's calendar that shows how many times Bill Gates met with him, and like he's revealing, he sucked out of the data what's the truth about all this. So our friend Dan Maycock, so anybody who's trying to do AI and ag and trying to figure out how to transform their business should call Dan up. Dan used to be our CTO at iSelect. He's now on his own doing AI stuff. Dan is a magician with this stuff. He did an exercise with one of the ex-USDA leaders who's like the guy on commodity trading. And his name is Bob. And so Bob, for like 20 years, has been the guy who really understands commodity trading in a whole bunch of different ways.
Okay.
So Dan, I think I can tell the story. I'm going to tell it anyway. So Dan,
the audience keeps getting bigger, so you do have to be careful.
So Dan took Bob's PST, his Outlook. Bob has his 20 years of email.
Yep.
In his PST. So it's everything that Bob has done. And he took the send box from Bob's PST. So that's everything that Bob generated and sent.
Yep.
And he took that entire corpus and stuck it into an LLM and said, write a script, write a prompt that characterizes Bob. And so it wrote a prompt and it created this, 20, 30 page prompt that is sort of Bob as characterized by his sent email box. And then he had Bob sit down and talk to Ask Bob and test the real Bob against Ask Bob. And Bob apparently used it for a little while and said, you don't need me anymore. So now so I sent Kevin Bass a note today and Dan and said they should get together. They should take Epstein's sent email box, which apparently is in these disclosures. They should go do an Ask Jeff, and they should go put it online. I don't know if anybody wants to get the URL for that to give it to these two. Put it online, and then all of our questions about what was going on with Jeffrey Epstein, we just ask Jeff, and then maybe we get to the bottom of what's going on and really figure out everything.
That would be awesome.
That was my morning. If anybody's not, I'm sorry, I said this the other day and people thought it was nuts, and I don't really care. Maybe you should need to show it. I don't know if you can get on X. If you're not on X, paying attention to AI, you're 3 valence levels away from what's going on. Yesterday, 2 things happened. One, Perplexity came out with a platform that allows you to basically do
Tell
Claude
people
AI
what Perplexity is. Tell people what Perplexity is.
Perplexity is the one that nobody knows about, but some of us do. So you've got OpenAI, you got Claude, and you've got Perplexity. Perplexity is a bit more of a orchestration engine on top of the other AIs, but it focuses more on recent news. And so it has a lot of where OpenAI and Claude are sort of trained on 6-month-old data. Perplexity can deal a little bit more with real-time data. And so we use Perplexity like when we want to fact check something. We write an article, we push it over to Perplexity, we say, fact check this, make sure we haven't lost our mind or we haven't misstated something. But Perplexity was sort of, everyone's like, well, Perplexity is going to go out of business because this gap is closing and Perplexity doesn't matter any longer. So Perplexity released to its Max users yesterday, Perplexity Compute. And somebody took Perplexity Compute.
On day one.
On day one and said, write the Bloomberg terminal. Now, Bloomberg terminal is licensed per individual $25,000 a year. 2 individuals. And what did it do? It wrote it.
Exactly.
I mean, I'm sure it's not completely it, but let's just pretend for a second it basically, because it's only going to get better from here. It's not going to get worse. So it wrote basically a lot of the functionality of a Bloomberg terminal. So for a $200 a month, if you have the, I think it's maybe a $300 a month subscription right now for Perplexity Max, you could sit down and say, write Bloomberg terminal, and which you would otherwise have to pay $25,000 a year for.
There's so much of that. I mean, the point.
Okay, so that's thing one. Hold on, that's thing one. I'm sorry,
No,
I'm
you're good.
interrupting.
Just keep going.
That's thing one. That's thing one. So, thing
I'm going to
two.
give you a shirt. You know those shirts? Thing 1, thing 2. Keep going. Sorry.
So thing 2. Someone who's a big user of Claude has a friend who's, a BSD over at Goldman, vice president, and what he said, what do you do all day long? And he's like, well, I model with Excel and do this important stuff, modeling stuff with Excel. And he's paid $1 million a year for that or something like that. And so he says to his friend, he's like, well, so what do you use AI? He's like, oh, yeah. I'm way ahead of everybody. It's like, so what are you doing? It's like, well, I use OpenAI to do this stuff. And he's like, have you used Claude yet? What's Claude? What's Claude? He didn't even know what Claude was. Had no idea. This was like last week. He didn't zero idea what Claude even is. So the individual asked his friend this, walked away from this, like, so an average Joe, who, if you use Claude Excel, you're going to 100x anybody doing this modeling at Goldman. So an average Joe can get Claude Excel and do circles around Goldman VP guy making $1 million a year writing Excel spreadsheets. And Goldman guy doesn't even know that Claude exists. Now, if he lane changed over and figured out Claude exists, that might change something. But
that turned him into $100 million one?
So the diffusion rate of understanding new technology. Now, this is the same thing. Now, this is going to be a real lane change. Food is health. Not many people realize that food is health. It's the same problem. Not many people understand what the reason why there's so much hate on Casey. One explanation for so much hate on Casey is that the people hearing what she has to say can't comprehend what she's saying. They are like the Goldman guy. He's like, what's Claude? So if you go in and you say, well, I can use Claude to use Excel to do this stuff and blah, 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 you're telling somebody whose entire existence has been, I got A's in my classes and went to Hotchkiss. I got A's in my classes and went to Harvard. I got A's in my classes and went to Stanford Business School. I got A's in my classes and passed the interview, and I got into Goldman, and then I worked hours and hours and hours, and I got up here, and now this is the reason I'm good at Excel is because of all of this stuff. And so if somebody comes in and says, no, we can replace most of your white collar function in a moment, in a flash. So if you're a doctor that's gone through whatever, I don't know, how long does it take a doctor to become a doctor? Like 400 years?
Oh, by the way, my friend who I run with during the week, one of my friends, I have two friends, I have a bunch of friends, but two in particular that I pretty much run with 3 days a week. She's a doctor and she's an OB. She hasn't been practicing and she's going back in as a concierge doc starting next week. I got her today to agree to come on the live stream so we can talk about concierge, scaling personalized medicine and AI as a doctor.
I shouldn't say this. My wife has concierge doctor. I don't. And I get like side treatment from the concierge.
I'm sure you do. Anyways, keep going. Sorry. Speaking of doctors.
So the paradigm thing. Another way to interpret this noise is Casey Means is a radical whack-up who doesn't understand science, who never got an MD degree and doesn't have the credentials. That's Casey Means A. Casey Means B is, I started doing this, I realized I got a sick feeling in my stomach when I was thinking that I'm going to go make all my money, $100,000 a year doing valve jobs. $100,000 a job doing valve jobs on people doing cardiology, and I'm never going to diagnose the patient right. I'm just going to sit here and do surgery on these people who are now sick that are at the tail end of disease. And I'm going to go get to houses, I'm going to somewhere in Breckenridge, and I'm going to, whatever. So that's Casey Means B. Or there's Casey Means C, maybe, that's like, what the hell am I doing? And I'm going to jump off the cliff. And where does she jump off the cliff? Into this no man's land. Like, nobody honestly is sitting there saying, here's the rational science engineering principle to avoid chronic disease.
Right.
You have the blandamistic toys of all the people that, like...
She mentioned PCOS in the hearing. I just didn't have enough time to actually find the clip to be able to put it on.
So now you're into column C of like Casey Means C. They're like, I'm going to jump into this environment. And in so doing, I'm gonna say stuff, and I'm gonna say some crazy, stupid stuff, and I'm gonna say some crazy, important stuff. But you're in crazy land because there's a void of an understanding of
Look,
really what is.
I'm gonna go down for just a second on that point about crazy land. I saw just a minute ago on this here, you can kind of see it. This is why I'm doing this, by the way.
So it's built a database.
Back. But
it's
so okay, wait. It's my turn. It's my turn.
Okay. I just want to tell you that Claude is.
I know Claude is better than me. I know Claude is way better than me. But so
no, if Bobby's down there, if Ryland's meeting with Bobby, then
all right. Well, then I'll text when it's done. I will text Ryland. I will send him one text because my guess is once I send him one, that's going to be it if he even sees it because he's tied up. Okay. There is you see on this screen here, right over to this part, Collins cites Surgeon General, quote unquote. Collins says, you began using illicit psychedelic mushrooms. So this is these are the clips of controversy, right? Is that Casey in her book, I guess, talks about psychedelic mushrooms. Here's the point about psychedelic mushrooms, which I find fascinating. I've thought about this recently is, do you consider psychedelic mushrooms drugs or do you consider them ancient medicine? And I understand leeches, bloodletting, like these all fall in the same category. But like when you talk about evolution like you do, there was a bunch of stuff that we did that kept us functioning pretty damn well until the turn of the century in the 1900s, right? So I just that's a perfect example. Like we're going to call her crazy with a capital C and forget about the fact that she's actually put on the again, it's not about her. What I wanted to do with this whole thing that I put together was we have an opportunity to redesign the system. We have somebody that's getting ready to potentially get confirmed as Surgeon General who sees that we have a systemic problem, that we are not addressing the root cause of health, that it goes from soil all the way to cell, right? That's what I care to see as a tailwind, whether it's a person, an administration, it could be private industry. That's the piece that's important. It's my turn. So now you want to go back to Claude?
No, it's working. We got to figure out.
So there's some comments. Do you want me to read the comments? We've been ignoring the comments. By the way, we hit a new high. We have 70 people that have joined us today, Carter.
EPA comp tox CSV download one file 4,000 substances with cast numbers. It's a single wise leverage move. Get to from. Let me tell it. Can you write a prompt for Claude CLI to build the crawler and the database? Store it in the.
So you're basically answering the grass question from the 60 Minutes episode while we're running a new episode, which, by the way, you know how I went down the whole rabbit hole yesterday and I was not a particularly favorable spot. I realized this morning it's because the gravity of what we were trying to accomplish for the moment yesterday sort of overwhelmed me. I have to pull myself out of that, and generally speaking, it doesn't affect me. But yesterday, for whatever reason, it sort of was this like thing on me. But the agent, what you wrote about in your creative destruction Substack of how you deployed the agents on the board call, I'm not kidding you. I was dreaming about it last night and how to deploy our own agents for Cressonia. Like this is what I woke up at 3:55 in the morning realizing I was dreaming about.
Do you want to? I can't remember what I wrote. What did I write?
Well, let's not do that for now. That's a teaser because we only have 20 minutes and we have to get through a couple of other things. Okay, so let me get back to the notes.
So I guess as a side note, this is problem co-work. It's beta. And it just threw an RPC error. So I've got to figure out how to reboot it, restart the VM, and then move over to Claude CLI.
Right.
But I
You
can't
were
do
in
that.
you were in co-work, weren't you?
Yeah, co-work.
I don't like co-work.
I don't like co-work either, but sometimes when you start this stuff, I should have started in command line.
That's
but
why I asked
anyway.
you.
I know, you were right.
You're teaching me something. This is not where I normally live. Okay. So Garden Wren jumped in and agreed with you, made the point Stafford's the one gets to control the interview process. That's supposed to be a confirmation. Then says that this was the point that I didn't want to miss is the gap nobody on that broadcast named, and this is about 60 minutes. The GR fills. Kessler wants to remove bad ingredients. RFK Jr. wants transparency. Poland wants subsidy reform. Casey Means wants regenerative school food. Carter wants System C. Michael Pollan told 60 Minutes. So I think the point is, and I'm sure that we'll get more input on that. But, you know, everyone's kind of all over the map. I think, okay, then another question, does Mark Hyman have a role in these levels of conversation? That's an interesting one. I don't know if we want to go there. And then the other piece, just so we can go back to that one, but I don't want to forget this, which is Mike, our buddy Mike Williams said that Bass posted that he's raising money to support his Epstein research. So I guess it's okay, Carter, to post that you're raising money for your exercise bike. Just saying.
What did he say about his Epstein research?
Apparently he is raising money to support his Epstein research. Bass is.
He was doing that?
Bass.
Oh, he is?
Apparently, according to Mike. I take Mike as a very credible source.
I wonder if he responded. I DM'd him because he and I interacted a little bit on something at one point. Because he was going to build a health app.
Oh, you're talking about Bass?
Yeah.
All right, well, let us know.
And he sent me some questions asking about how to do the health apps right.
So, I mean, the question about Hyman, Hyman is involved in these, but he has definitely taken a more private industry startup. I'm over here doing.
Have you shown? Can you show that ad that I sent you this morning?
Yes.
And the Hyman comment, I think Hyman is looking to try to do it with commercial.
Exactly. He's on the private industry side of
good.
things. Yeah, this ad you sent me, I should have teed this one up because this one, I love it whenever I get these from you in the morning. It's like, okay, let me send this to myself.
It's a funny ad.
I think that's all the comments that. Did you hear me about we broke a record? We're at 71. We've got 71 people that joined us today.
You want to tell them the other thing that happened?
Did you hear me just say that?
I did hear you say
But you haven't reacted yet. You haven't said like, oh, that's cool. Hey, everyone.
When are we going to get to 100?
I don't know. Just like when we hit 10,000. So everybody knows we have been chasing the elusive 10,000 subscriber mark for quite some time. And thanks to all of you, we got there. What was it on Friday, this weekend, Carter? I don't know.
We got there a week and a half early.
We got there. Well, but that's only due to the last few months. But anyways, bottom line, just for everybody
10,716.
I called Carter to say we did it. We finally got over the hump. And what is the first thing he says to me? When are we going to hit 20,000? I'm not going to repeat out loud how I responded to him. But those of you that
the reason that's important is because there are people using OpenAI that don't even realize that Claude Excel works better, who are power users. And we have people that are more stuck up in System B and refusing to accept that there's a new way to do this. And we need to get more education out.
I agree. So I'm not sure what's going to happen when I do this. Did it just get bigger?
Yeah, it did.
Okay,
That's
good. Because I can't see it. Anyways. Okay, here we go.
Perfect.
So this is the video that you were just referencing. Do you want to give any context? Or let's just watch it. Don't give it any context. This is, but just for everybody's, edification, at 7:30 this morning, this was the text. This was the link that was in my text from Carter.
By 2030, almost 80% of people had lost their jobs.
They had no money, no purpose, but they had a lot of time on their hands.
The less people actually did physical work, the more they wanted to appear as if they did.
What if we could use the energy of humans to power the machines that took away their jobs?
Energem solved our need for energy and your need for purpose.
That's a different kind of future cast.
I mean, that one, somebody's got to comment on that one, I would think.
It's sort of funny, but that's a different kind of future cast.
Yeah, that's a different type of future cast, all right.
The point, I think, in my article on Monday is if we bring up, I can't bring it up. I don't know if you can bring it up in my, can you bring the article up? I think, did I,
your
total
creative
factor
destruction article?
The one I did on Monday that you reacted to.
Yes,
I don't know how to bring up your screens.
I can pull it up.
Did I have a TFPI post in there?
I don't know. Hold on. You just used an acronym that didn't resonate with my brain currently. So.
Yeah, so there, for everybody's benefit, there's sort of, we normally talk about in economics productivity. You know, if I can do something easier, my productivity improves, so I produce twice as much. And we can measure productivity based on a lot of economic output, but there's another point referred to as total factor productivity. And that sort of refers to the productivity that if all of us start using Google search and search is a lot easier, it's more difficult to, you can see the productivity gain at GDP level, but you can't necessarily attribute it to one specific thing. And so that's really what total factor productivity measures, is the degree to which there's a spillover effect in the economy that drives other productivity gains.
So wait, time out. I'm going to cap you at 2 minutes on this because I'm just going to warn everybody. Let me say this. Let me actually hold on. You're going to get very aggravated with me, but
scroll down to the TFP chart.
No, I don't want to go there yet, and here's why. Because I want to give people that are on this who cannot emotionally handle AI and what it does to their brain, the idea of what the ad we just showed, there are certain folks on this chat that probably will be like, I cannot do this. I'm going to give them an out. So we're going to save this for the last piece of our thing. I just want to hit two things before we go here. All right.
Okay.
So the first thing is, this is fun. Next week, I think we might both be there. I have not gone before, but I'm going to this.
Yeah, if enough people tell us we should go, we'll go. So if you like this episode and enough of you like it, we'll go.
Well, I'm going. You're kind of cheating. Okay. I'm kind of cheating. I've already submitted for us to go, but I will say, so I'm going to go to Expo West. Carter is going to go if he gets his media pass approved. So if for some reason somebody knows somebody that runs the Expo West stuff and the press people, it's New Hope Media or something, let them know. But I think that you'll get it because mine went through really quickly. But anyways, we're going to cover this. What would be super helpful, because I've never gone and I suspect that this is like health, which is HLTH, which Carter and I have both been to now. It's like the boondoggle of healthcare. I suspect that this is like health on steroids. And then the other piece that I want to add is the following week, I'm probably going to go to HIMSS, which is the big healthcare tech. I wasn't going to go, but a buddy of ours invited me to one of the super cool dinners. So I'm probably going to fly out to Vegas for that thing. But in doing that, it's assuming my media pass gets approved, we'll also cover HIMSS, going to try and cover it. But for Expo West and for that, like what's really helpful for us is like, what do you guys want us to cover? Like, what do you want to see? You want me just to walk around the showroom floor and like film stuff? You want me to talk to certain people? I mean, I know what I want to go and listen to. Like, for example, Bain is going to do some strategy discussions. I want to do some of that. Our buddy Kelly Ryerson's going to be there, Carter. And so is Nick from Whipstitch Capital. Our buddy Sherry Fry's going to be there. It's going to be like old home week. Ellis is going to be there. Anyways, Mike Williams just said, how did they get a video of me on a row machine? I'm still in shock. His cameo appearance in the AI generated video. Okay, and then the other thing I wanted to cover before we go. What do you want to say about Expo West? And then I'm going to cover this last piece.
I'm not going to say anything else about Expo West.
Why?
Just keep going. No, I think you covered it.
Okay. The last is a really big one, which is Food Health Live in Nashville. It's actually in a farm outside of, here we go. So the big news is that, here's the big news. We now have a track. So the agenda, we now have an actual food health track that you and I have developed. And we need to get a proper discount because I just noticed that the discount code that they've given us is less than the discount code they have on the website. So I need to get that straightened out. So the first thing is this. First day 1, April 29th. Carter and I are leading the How to Food Health Innovation Lab. We did this last year. It'll be kind of an unconference type format for the curious. So definitely come and sign up for that pre-conference, not pre-chronic. And then this is the big announcement. So track 2 is called Food Health, the How-To Playbook. And we're going to start off the day. We're truly going from soil to cell. So we're going to first frame the science, which is monetizing health, not disease. So we're going to frame that whole piece up. Our friend Katie Stebbins is going to present with us, Carter, on that first panel.
Cool.
Then we're going to start at the science of human health. We're going to dive into that. Dr. Joe is going to be there. Ellis is probably going to be on that panel.
Dr. Joe is G.
Yes. And I'm hoping that we have a couple of other folks that may join him on that panel. Then on the next session is measuring what matters, the evolution of human health outcomes. We have the founder of Inside Tracker, as well as the CEO of Intus Bio, and possibly the chief medical officer of Prenuvo will be on there, which is the full body MRIs. Then we have the longitudinal data and agentic intelligence from soil to cell. And then we go to reformulating food for health from the ground up. We have our friend Emily Roach from Morrissey Market, who's on this call, as well as Eric Smith and Bob Jones from Chef's Table, who's also on this call today. So both of them will be talking about how we reformulate food from the ground up. Then we will
we've got to talk about doing an unconference on your farm in June.
Yes, that'll be the next unconference. Is going to be in Ohio at Chef's Garden. Which we're slated to talk with Bob. I don't know if I have you on that call. I have time with him tomorrow, so I was going to talk to him some, but we'll talk to him more. Then we're going to do reformulating food for health. You are what you eat, which is where we're going to talk about reformulating food in general. So we've got Plant Strong. I'm not sure if Lori's on today from Plant Strong. We've got Hull Biome and Ingredion all there, and then we go into delivering primary prevention through food. Right now we've got Carmen Brace and Katie Stebbins. Actually, it's supposed to be Carmen and Ellis. We also may have a retail grocer. I think she's just running it through. I don't want to give her away, but she's just running it through her media people. And then finally, we're going to do the last two are going to be ending the chronic disease epidemic with the future of healthcare. So a redesigned healthcare. And that's our buddy Andy's going to be on that panel from Garmin, our buddy Yuri from Nudge Health. We also have Food Health Collective on that. And then the very last one is we're going to do a future cast, and we're going to have the capital providers in the market, on the stage. So we've got 2 big healthcare investors and some others, but I've got our buddy Gen Gillespie, a self-proclaimed System C spy, and then Chris Rogers from Ziegler. So anybody on here, Maura wants to be on the health outcomes panel.
Who does?
Maura, you and I can talk. So that's that. You want to add anything? What do you want to add? It's on a farm in Murfreesboro outside of Nashville, which would be super
I've
fun.
got to get on a call in 2 minutes with Ellen Fitzgerald to talk about improving the beef supply chain.
All right. Well, do you want to hit on this? Make a 1 minute. Okay, make a 1 minute thing on this, and then we're gonna go.
Learn about total factor productivity. Pull up that chart if you can. And essentially, total factor productivity has been off the charts in IT, and it's been a laggard in every other of the 40 major categories of industry. So this is a terribly disruptive kind of period of time, but there is a vast gap of productivity, total factor productivity. And when you free up total factor productivity, you create more opportunity and economic growth. I know it's stressful, it feels bad, but it used to be that we spent 100 hours a week making our food on the farm, and then we went to 40-hour work weeks, and we'll go to a 30-hour week and have more money. So it feels bad, it's scary, but there is ample opportunity outside of the IT realm to completely reform productivity and change it. It's going to be disruptive.
But I don't need to go sell my house, is what you're telling me.
You just got to decide which side of the equation it is, but it feels a whole lot like COVID.
Okay, have a good call. I have a call too. Thank you all for joining. Next week, we're going to talk healthcare. We're going to dive into risk coding, the infamous upcoding. We're going to talk about that.